Combining form for ribs is costo. And so if we refer to something as being intercostal, we mean that it's pertaining to between the ribs. So when we do bones later in the semester, we'll revisit this word again. So for right now, any one of those 12, transverse bones you have in your thoracic cavity that hold everything together, those are called ribs classically, and the combining form is costo. Okay, a couple of diseases here we're going to take a look at. Influenza is acute contagious respiratory infection characterized by a sudden onset of fever, headache, and muscle pain. So you often hear people associate influenza with stomach ailments, and they'll say, oh, I've got stomach flu. They actually don't. They have something that you'll learn is called gastroenteritis. And when we get to that chapter, we haven't got there yet. Anyway, influenza is simply this. It's fever, chills, and headache, and muscle pain. Those four diagnostic criteria. There is no vomiting involved. If the patient is coughing until they're vomiting, we would assume that they may have something called pertussis and or whooping cough. We can immunize against influenza. I recommend you immunize against influenza. We have lived with it for a long time. One of the reasons that doesn't have the capacity to kill as quickly as corona is because we immunize against it. If we were to stop that altogether, influenza and corona would be competing to see who could, take the most lives every year. I think we have annual deaths of influenza somewhere in the range of 30 to 35,000 a year. So influenza is not a simple disease, and if you have asthma or another underlying condition, or God forbid something like COVID that's been combined with influenza, it's a very treacherous situation. So we want to protect ourselves. If you're going to work in healthcare, you're going to have to be immunized annually for influenza, and I highly recommend you do. I have seen more than one person not survive bouts of influenza, and it's very unpleasant, and it doesn't necessarily always affect the elderly, as is also believed about COVID. Now we're finding is not at all true. People in their 20s can die from COVID as much as someone in their 60s, 70s, or 80s. Pneumonia. It's a complication of a viral or bacterial infection. Pneumonia is an acute inflammation and infection of the lungs in which the alveoli fill with secretions. So in the upper diagram, you see normal alveoli. They're nice and clear and open, and oxygen exchange is happening, and everything is as it should be. If you look at the bottom one, we have pneumonia, which is going to look a little bit like bronchitis in terms of the mucus that's gathering. In this particular case, the mucus is gathering in the alveoli and not the bronchioles. And that's pretty much pneumonia. Lots of coughing, lots of shortness of breath. If it's bacterial, which it often is, they'll give you antibiotics. Some types of viral pneumonia are secondary to another viral infection. So you may have had some type of bronchitis that was viral. It sort of cleared up, and then all of a sudden you come back with raging pneumonia a few days or weeks later. And so it can be a complication as a secondary to an infection. It can be a primary infection. Either way, it definitely needs medical attention. So pneumonia is nothing to, sit home and ride out. A common cold, you stay home, right? You don't go around people, you do all that comfort stuff. But pneumonia, influenza, they're a little bit more serious. So you want to take them a little bit more seriously. Along with pertussis, it can be very serious. In fact, people who go unimmunized from pertussis, especially in certain countries of the world where they don't use immunizations or they don't have access to immunizations, their deaths from pertussis or whooping cough are very high. We don't see those high rates in the United States because we immunize against pertussis. So whenever you get a tetanus shot, there's usually a pertussis component to that. We want to make sure that you are immune, not immune, but immunized against pertussis. Once again, this is a deadly disease. It has a whoop-sounding cough. If you've ever, for those of you who are parents, or maybe as a child, you might have had something called croup, which had kind of a barking seal cough. But pertussis will sound like that. Croup is benign, especially where we live. If someone has croup, we tell them to open the window. The fresh sea air, we usually will help clear it up. Pertussis, that whooping cough, is going to be accompanied by a very sick person. It's coughing fits that will be coughing until there's vomiting and then coughing past that. Pertussis is a very serious respiratory infection. It's something you don't want to play around with. And although we don't talk about it here, common varicella, in other words, chickenpox, is also a very serious respiratory infection. People often think that chickenpox and or varicella, if you want to call it by its real name, is just a skin rash. It is not. It is a respiratory infection, and it's potentially deadly, and that's why we immunize against it. My parents were both born in the early 20th century before we had immunizations. As a matter of fact, before penicillin. And they clearly remembered before, I mean, they're not with us anymore on planet Earth, but they clearly remember people dying from pertussis, dying from simple infections, dying from pneumonia, dying from these things that now we consider to be treatable. But in the early 20th century, just 100 years ago, people died from pertussis on a regular basis, and it was feared. It was as feared as much as COVID is scaring us right now. So it's best to take care of the situation and immunize if you can, and everyone has various beliefs, and I'm not going to go into any of that here, but there is a definite scientific advantage to the process of immunization. Tuberculosis, abbreviated TB. This is an infectious disease that produces small lesions or tubercles on the lungs. If it's left untreated, it can affect bones and organs. So it starts out as a respiratory thing. It's highly contagious, which is why we contain it immediately when we find it. You do not want to get exposed to it. If it goes unchecked in the lungs, it can spread through the body and cause all kinds of crazy things to happen that will be related back to the original tuberculosis infection. Some countries have tried to immunize against it. It doesn't work. This is a very resilient virus that you have to deal with, and it's not going to go away easily. So we want to keep those infection rates low. Once again, we don't see it in the United States as often because we're very cautious about it. If you work in healthcare, you'll have to get what's called a PPD. And before, when we talked about those angles of the needle for injections, one of them is that really flat one. That's what they do for a PPD. You'll get that medication placed in the arm. You come back a couple days later. We look at it. If there's no swelling, you're fine. You're clear of tuberculosis. If it does swell, then we do a chest x-ray, and if tuberculosis is found, you're going into an isolation room and you're going to be treated. So, and I want to correct something I just said earlier. I called this a virus. I believe it's actually a bacteria, but I'm not certain which right now. I'd have to look it up. So don't quote me on either of those, but just know that tuberculosis is a real bugger to deal with. And if you work in healthcare, you'll have to make sure you stay clear of it and get yearly tests to prove that you're clear of it. Pneumocystis pneumonia. Pardon me, I kind of stuttered there. Pneumocystis pneumonia. This is a type of pneumonia seen in AIDS patients. So in AIDS, you may know that the immune system is completely shut down, and a simple infection or a simple something that you might be breathing in right now that your body is fighting off, and you don't even know that battle's happening. Well, you take the AIDS patient and they have their immune system is completely blown up at this point, so it's not working. They get that exposed to that same thing, even maybe a common cold, and it could result in something like this. So anyone who's immunocompromised, including people who have full-blown AIDS, we have to be very cautious in what we expose them to in the healthcare community. And speaking of AIDS, acquired immunodeficiency virus, I'm sure you probably know all about this. I know they teach it in high school, how to avoid it, and we know that we want to avoid HIV infection because that can lead to full-blown AIDS infection. So for your exam next week, just know what the acronym is and know what it stands for. I mentioned earlier chronic obstructive pulmonary disease, or sometimes they say disorder instead of disease, COPD. This is a group of respiratory disorders characterized by a chronic partial obstruction of the bronchi and lungs, and in some cases a full obstruction. There are three major disorders. We've already covered one of them, which is chronic bronchitis. I showed you that earlier. But you also have asthma and emphysema. And all three of these come together at the same time. And guess what? COPD, the major cause is cigarette smoking. Second major cause is environmental contamination. So you have to be really, really careful with smoking cigarettes. Not advised. I was a heavy smoker for many, many years. I haven't smoked in more years. I've quit smoking longer. How do I say this? I've been a non-smoker longer than I was a smoker, and I smoked for 20 years. So I smoked for a long time. And I did have some of the side effects of it, and I still deal with them. So COPD is something that it results from that kind of behavior. Three components, as I said. Chronic bronchitis is number one. Number two is asthma. So this is a chronic form of asthma. Respiratory condition characterized by recurrent attacks of labored or difficult breathing accompanied by wheezing. I talked before about the bronchioles. Here they swell and fill with mucus, and that's asthma. Bronchodilators will turn that around. We have emphysema. This is the most severe of the three types, of the three components, rather, of COPD. This is a chronic disease characterized by overexpansion and destruction of the alveoli. Basically, there's stuff in cigarette smoke that breaks down skin. Smokers age more quickly because it breaks down the collagen. It has the same effect in the lungs. So after years and years of smoking in those bronchioles, as you see here, the one in the image here in the middle, it's a normal bronchiole and alveoli. That collagen that's in that tissue that makes up that bronchiole, it starts to break down. And one day, after years of abusing the lungs, that bronchiole will collapse. The air will be trapped in the alveoli, and you just killed off a whole bunch of alveoli. Emphysema is this disease, and it's exactly what it does. It takes it one group of alveoli at a time until breathing is really not possible anymore. It's a very slow, drawn-out procedure. This can take a decade or more for this to manifest itself. If you ever see elderly folks walking around with an oxygen tank, they most likely have emphysema. It's something you do not want to have. Absolutely do not want to have. And the three diseases I just mentioned associated with COPD are all directly related to cigarette smoking, as are certain types of other cancers beside the lungs, especially in women. Cervical cancer is associated directly with cigarette smoking. And speaking of lung cancer, well, malignant cancer frequently results from cigarette smoke. It's the second, what do they call it? The lung cancer is the leading cause of cancer death and the second most common cancer in both men and women in the United States. So not to be trifled with. Lung cancer is dangerous. It's out there. Cigarettes are one of the most common reasons for it. Really, your body was not meant to inhale smoke and blow it out over and over. I strongly suggest if you are doing that or vaping, and we've now beginning to find out that vaping is equally as bad as smoking. The pathologies are different. You may not get lung cancer, but COPD is definitely an option. So we want to avoid lung cancer at all costs. We're going to wrap things up by giving you these two words, morbidity versus mortality. So if you ever deal with statistics and data of healthcare, these words are going to be very prominent. Morbidity is the disease rate, so how many people got the disease. Mortality is the death rate, how many people died from it. So here's an example of that kind of data collection here. I think this is from 2012 or 2010. So it's antiquated data. It's no longer relevant. But there you have it. It shows the difference between morbidity versus mortality. So when we're looking at statistics around diseases, and you know for certain that this data is being collected about COVID right now, and you can see it on the news every night, they will talk about morbidity versus mortality. Now, you may not be paying attention to that, and if you are ignoring it, I can't blame you, but you want to stay informed if you're working in healthcare. And morbidity and mortality is one way of understanding disease rates and infection rates and death rates. Here are your abbreviations. I'm not going to read them off to you. Hopefully you got them as we did the lecture. Some of these will be on your exam next week, and some of them you'll never see again. So there they are. Thank you very much for your time and attention. That's everything you need to know about the respiratory system. As I like to say, just enough medicine to be dangerous. Go forth, learn words, and our next chapter is going to be over the cardiovascular system, and it's one of my favorite systems to cover. So we'll be covering that in the next lecture. Hope you're all doing well, and we'll see you in Chapter 5.